I want to introduce you to Mike Bing Crosby. He's a retired U.S. Navy commander and Top Gun graduate. He's also the founder and CEO of Veterans Prostate Cancer Awareness. This is a nonprofit started after his diagnosis. And he's with us this morning. And I have to ask you, because for those at home, they don't know, you are a three-time prostate cancer survivor. Talk to me about some of the things that people should know, because, you know, this can help so many people beyond veterans.
Yeah, Marcus, thanks. Good morning. And really, the one thing that everybody needs to know is that if you're a veteran, you are at a higher risk of developing prostate cancer or a lot of other cancers. Some studies have recently determined that exposures to things like you may have heard in the burn pits or the other different types of environmental exposures that we just happen to come across every day in part of our job and our lives puts us at a higher exposure. And that, coupled with the known risk factors like being an African American is one, and also if you've had prostate cancer in your family, from a hereditary perspective, you're at a much higher risk as well. And it's just something to be aware of. Men are just not good at taking care of their health, and they need to get checked early. And if you're at a higher risk, you need to start your simple PSA blood test at age 40.
Yeah, I was just going to say that, Mike. I know a lot of my friends, we talk about this. But so what are some of the things that we can look for? I know you said the blood test, the PSA blood test is something you can take, but are there symptoms that you may experience or notice?
No, there's very few symptoms. It's kind of a silent disease that sneaks up on you, which is why the importance of doing the screening. If you are, however, experiencing things like any kind of urinary type issues, urgency, or any kind of pain or anything else like that, you do need to go see somebody. It's not just the fact of getting old or drinking too much coffee. You need to go and see a urologist or talk to your primary care and get the proper screening done. I am alive today because of nuclear medicine and the clinical trials. As I talked about, or you mentioned that I've gone through this 3 times, and every time that I've gone through it, we've used nuclear medicine scans to find the cancer and actually change my course of treatment. And it's because I did it at the VA, at the West LA VA, it's just something I feel is fairly passionate about, the whole nuclear medicine, the advent of new technology. And you get access to those either now in primary care or in the general care, but also through clinical trials. And we really encourage people to look into those things.